So as an overview, what I will be presenting here is there are three different aspects when you're thinking about traveling and healthcare and taking care of yourself. You have to think about it before travel, while you're traveling, and after travel, you may need to watch out for some symptoms if you have been exposed. Next slide. Provider, what do you do before travel when your patients reach out to you? Essentially, you need to know where they're going and their itinerary. Then the intake. At the intake, you also need to assess individual risk, and you also manage the risk by vaccines, prophylaxis, and education. It's very important to understand that these are all risk mitigation strategies and do not eliminate risk altogether. Next. So before travel, it's important to understand that a visit has to be scheduled at least 4 to 6 weeks before travel. That's the ideal situation. Sometimes we travel, the travel arrangement can be in the last minute, but usually most of us are traveling for pleasure, so these are scheduled way ahead of time. Now, the travel evaluation can either be done in the primary care physician's office or in a travel clinic. It depends on whether the primary care physician would do it. Now, essentially, before travel, you need to get information about the patient. Like I said, itinerary and the purpose of travel. Purpose of travel is extremely important because that will assess your exposure risk. So if you're traveling as a tourist versus somebody who's going there to study abroad or visiting family and friends, your risk exposures are very different. In a travel clinic, if the same thing happens, your intake is extremely important. You should get as much information as you can, both about the patient and the itinerary. The link below provides some, it's a template for the patient to check off or the traveler to check off prior to evaluation. I would use it as intake sheet. Next slide, please. So the most common questions that I get related to travel is vaccines. What vaccines do I need to take? I'm going to XYZ country, and I do get a lot of these as curbsides from colleagues, but understand that this is a more involved assessment. So it does take time, and you do need to have a lot more information than just where you're going and who you are. So when it comes to vaccines, definitely the easiest thing to do is to update all your routine immunizations. And if the seasonal influenza vaccine, depending on if you're going to the Southern Hemisphere and you're traveling in the summer in the Northern Hemisphere, then you definitely need to take your influenza vaccine. They do have, in this table, you see the travel vaccines and the number of injections. Now, this is the reason why we have you come at least 4 to 6 weeks ahead of your travel. Because if there are 2 or 3 doses of a vaccine that needs to be given, that may take about 4 weeks, especially like hepatitis A or B. And also, your immune response takes at least 10 to 14 days. Hence, the last dose of vaccine that you take prior to travel should be at least 10 to 14 days prior to getting on that plane. Next slide. In addition to vaccines, you have to think about what are the concerns you have in terms of infectious diseases and exposures, and what are the preventative measures and whether you need any prophylaxis. Now, selecting what kind of food and beverage, and especially for families traveling with infants, breastfeeding and formula, and is very important. For the most part, I tell my families, eat cooked food that has not stayed outside for too long, well cooked food, and also do not try to avoid as much as you can salads and fresh vegetables unless you know the source. In terms of fruits, if you are peeling the fruit yourself, great, you can have it like bananas and oranges, but fruits that are unpeeled may have a higher risk for contamination. Now, do we need to use any medications? Bismuth subsalicylate has been recommended for adults, but not for children for diarrhea. And probiotics, we do not have sufficient data in prevention of diarrhea. Prophylactic antibiotics are a big no. They are not recommended. However, in unusual situations in an immune compromised patient, they may be, but then you need expert advice for that. And you should also need to understand where to get treatment if you do need medical attention. Next slide. Another big area of prophylaxis is prevention of malaria. Again, as you know, it depends on where you would be going, more so in the tropics. Not only where you're going, it also depends on the resistant patterns in that area. Now, understand that just taking malaria prophylaxis doesn't prevent you from getting other diseases related to mosquito bite. And also, you're only decreasing the risk of getting malaria, but not eliminating it altogether. So you should still use avoidance measures like using protective clothing, insect repellents, and bed netting or screens when sleeping. Again, I can't how important this is, because these measures, again, decrease risk but not eliminate risk. Next slide. The education piece, till now we talked about vaccines, prophylaxis, and then education is extremely important. Frequent hand washing and sanitizing. Understand hand washing in dirty water really doesn't hold. So you do need clean water to wash your hands. If that's not available, then a sanitizer is a reasonable alternative. And other things that you need to do, wearing seat belts, taking your car seats for infants and children. And one of the things we have learned since the pandemic or with the pandemic is prevention for COVID-19. So we still track new cases and also time your vaccines if you're traveling abroad and you do need some protection. Education about respiratory illness exposures. We just heard about the preventative measures, wearing a mask to prevent spread of infection if you have an upper respiratory infection, or if others around you do have, it does help. And this is in addition to hand washing or sanitizing. Next slide. So the resources for the clinician, again, there are a few things. I provided you the link to a template for rapid evaluation, what you need to get from the patient, and also some travel clinic information, because the yellow fever vaccine is provided only in certain travel clinics or the health department, and you need to schedule ahead of time so that they can acquire the vaccine specifically for you. Next. During travel, pretty much the same theme goes. Wash your hands, safe transportation, bug bites. Choose safe food and drink. Avoid animals. Excuse me. Avoid animals. Definitely use protection against sun and extreme temperatures. Next slide. After travel, depending on your exposures, if you have an illness within say 2 to 4 weeks after you return, it's highly likely, in addition to the common infections and illnesses that you could have from your community, you may have brought in something from your travels. And the physician assesses again the route, return dates, exposures, your vaccines and prophylaxis that you have taken, and also what is your risk factor for getting ill. So definitely have your patient touch base with you if these issues arise. Next slide. One of the infections outbreaks we are seeing in the US, predominantly related to international travel, along with low vaccination rates in the community, is measles. The most recent numbers as of the first week of May is about 139 patients in the US who have presented with a rash, and 82% of them are unvaccinated. So just make sure that your patients are vaccinated against measles. It's like it was mentioned initially, one dose protects you about 93%, and then 2 doses is almost 97 to 98% protection. So just make sure all your patients are up to date on their vaccines. And most of the children who are exposed or have disease due to exposure are children who have not been vaccinated. And I found the clinical scenario, very interesting. By the time this patient was diagnosed, a few people were exposed because of inappropriate personal protective equipment. One of the ways we can mitigate that is asking about international travel and immunization status. Increases your risk for measles. And also understanding what are the CDC recommendations for outbreaks. Next. So as a healthcare provider, a few things you should be on alert since we are now in an outbreak time. Look for patients with febrile rash, illness and symptoms consistent with measles, the 3 Cs, cough, coryza, or conjunctivitis, and an exposure or having recently traveled abroad to countries with ongoing measles outbreak. And you will see the travel health notices on the CDC website, travel website, which gives you what's the rate of spread or transmission in those countries. Infected people are contagious from 4 days before the rash starts and through 4 days after the rash presents itself.